Hello listeners, welcome to Views on Health. With me in the studio today is Dr. Navodha Atapattu, consultant pediatric endocrinologist at the Lady Ridgeway Hospital in Colombo, the premier children's hospital in Sri Lanka. Having said that, I'm sure listeners will recall that we had Dr. Navodha Atapattu speak on type 2 diabetes in children. But tonight, the focus is on hypothyroidism. Over to you, Doctor.
Thank you, Fatima. Hypothyroidism, it's an important hormone condition in children where the thyroxine levels are not enough for the growth. Two main types. One is congenital hypothyroidism, when the baby is born with low thyroxine level. That is the most important thing that we have to recognize as early as possible and treat them early, otherwise their brain development will get affected. In our country, there is a screening program to detect congenital hypothyroidism, that is the children born with hypothyroidism to be screened and detect early so that we can start treating them. So when a baby is born, they take a sample from the heel, a blood sample, and send it to the reference laboratory. There are two places where the tests are being done. One is at the medical faculty Karapite and the other one is at the Medical Research Institute, and there are some private hospitals where screening program is in place. So when the sample is assessed and if there is a change in the blood level, they will inform the pediatrician as well as the parent, and they will have to go and get another blood test to confirm whether it is actually positive. This is a screening test, so there may be times that the screening is falsely positive. So always we do a blood test as soon as possible to see whether the child actually has hypothyroidism, that is the condition where thyroxine is not produced in adequate amount. So if the thyroxine levels are not there, this is the easiest hormone condition that we can treat, because we can treat it with a tablet. It's just a tablet that they have to dissolve in water or breast milk and give it to the baby. So it is important that we follow this procedure, the screening program, and then to get the report as soon as possible to treat them at least within the first 2 weeks of life to prevent problems in the brain development that can have lasting effects in the IQ level and the growth and everything. Because of that, we have to treat them before they develop symptoms. We don't wait for a child to come with symptoms, then the time is up. There's no point in treating. I would say we have already missed the most important part of brain development. So we treat them as early as possible before any symptom that they would come up with. By doing this screening test, the treatment is, as I said earlier, thyroxine. We advise the mothers to give it as early as possible in the morning, first thing, and then wait for about half an hour to 20 minutes before the child is being fed, so that the absorption is happening properly. So this is a lifelong condition if the thyroid gland is not formed. So once the confirmation is done, we check the thyroid gland with an ultrasound scan, and if the thyroid gland is not developed properly, or if it is underdeveloped, or it is small, or if it is at a place where it shouldn't be there, we call it ectopic, it is at a different place where it should be compared to where it should be, and then it is called permanent congenital hypothyroidism. They should be on thyroxine lifelong. Even if they fall sick and if they go for any other surgery or any medical issue, they cannot stop thyroxine tablet, and they have to make sure that it is taken 2 to 3 hours separately from any other medications, because we don't want the thyroxine to be interfered with other medications to interfere thyroxine absorption and vice versa. So we advise parents to take thyroxine couple of hours away from any other medication.
Is this a common condition?
1 in 1,600 to 2,000 babies have congenital hypothyroidism according to our data. So it is, I would say, common, and also it is important because of this screening program, we have prevented brain damage or educational disabilities by providing medications on time. That much I can tell you, because we see quite frequently the patients who are coming with these positive results. Most of the time what happens is these parents come crying, saying that my child was diagnosed with this, and now whether the brain is going to get affected, whether the child will be able to go to school, or whether they can have a reasonable life in the future. The answer is yes, because we have started the child with treatment as soon as possible. So that is a good news. Even if your child has congenital hypothyroidism, the moment we start treating them, the complications that you are to receive are not going to be there. Nowadays, most mothers come and tell the person or the child who is on thyroxine is much smarter than the other children who are not on thyroxine. That is the most interesting and also happy information that we get from our parents, and that tells us that the compliance of the medications, and also it's a very good message for the other parents to have some confidence in the treatment that we are providing with.
That's good news, Doctor. I'm sure it's, as a medical professional, it can be heartwarming to you too.
Yes.
That the treatment is working, and they find that this child is brighter than the next other child in the house, maybe, or another known child. So it really augurs well.
Yes.
And these drugs are freely available.
It's freely available, cheap, and only thing is that you have to make sure that you keep it stored properly, otherwise it won't work. So it has to be kept in a place where the tablet does not get exposed to excess temperature, ideally room temperature, that is 25 degrees. So we advise our mothers to keep it in the environment, because our room temperature is around 30 degrees. So we advise them to keep it in a cool, dry place. That's the only advice that we have to give about the storage, and it is cheap. It's freely available.
And it's a prescription medicine.
It is a prescription medicine.
Thank you, Doctor. So now this treatment goes on for life.
Yes.
Even the child becomes an adult, it has to go on.
It has to continue, and we hand over such a child to an adult endocrinologist when they pass 18 years. And when they become pregnant, the requirement goes up, so they have to remember to increase the thyroxine dose, already on thyroxine dose, by 20%, so that the child is also having adequate amount of thyroxine through the mother. Otherwise, the baby inside the conceived baby will not get adequate amount of thyroxine if you don't increase the thyroxine dose of the mother, to prevent baby getting low thyroxine level. Because even at the antenatal period, during the pregnancy, this human body needs thyroxine. If they don't get adequate amount of thyroxine at that period, again the brain development can get affected, and also the growth. So it's a very important hormone which looks after many systems in the body, mainly the nervous system, during the antenatal period as well as the infancy.
Any advice regarding diet to maintain this correct level of the thyroid?
Thyroxine, when they take thyroxine, we advise them to take it half an hour before the main meal, before breakfast or before bed tea, so that the absorption is even, and then the fluctuations of the blood level will not take place if they take it properly at the proper time in the morning without the empty stomach. Then the absorption is better. Otherwise, if they take it after a meal or immediately after taking the tablet, if they take the bread tea or the breakfast, the absorption can get affected. Because of that, we advise them to take it early morning, empty stomach, so that the blood levels won't get too much fluctuated.
Doctor, when you take thyroid problems in adults, the females are more affected than males, am I right?
Yes.
How does it work for children?
For congenital hypothyroidism, there is no difference between boys and girls, but late onset thyroid disorders are quite common in females compared to males. The late onset thyroxine problems also can affect children. They come around 7-8 years of age with goiters, and if there is a goiter and if there is a family history, we tend to screen them for low thyroxine levels. We check the thyroid profile and see whether the child needs treatment. So again, those patients also require thyroxine throughout their life. Depending on the blood levels, we have to adjust the doses so that the levels are maintained in the adequate range.
Will this condition lead to any other ailments in the system if not treated properly?
If thyroxine level is not maintained properly in adults, they can get high cholesterol level and they can feel sick and their energy level will go down. So anyway, they will become symptomatic with that. Because of that, to maintain at least the cholesterol levels in the normal range, sometimes the adults need at least a small dose of thyroxine. If thyroxine levels are not in the normal range and also the lipid profiles are also deranged, they have to make sure thyroxine is in the normal range. So, and in addition, sometimes if in the females do not have adequate amount of thyroxine, subfertility, early fetal loss, all those fertility problems can appear when the thyroxine levels are not there. So it's a connected hormone which has some effect on each and every system, for growth, for memory, for energy balance, for thyroxine levels, and for fertility. So it has many contributions to the other systems to keep all the systems in the balance.
Would surgery play a part at some point if necessary?
Surgery we generally do if the thyroid gland is very large and if it is disfiguring. If the thyroid gland is large but not disfiguring, you don't have to go ahead with surgery. These goiters do not have an higher risk of malignancy. That is the misconception that most of the people carry. Thyroid cancers can be there, but that does not increase in patients who are having a goiter. Goiter per se does not increase the cancer risk. If there is a cancer, yes, that can be treated. That is the cancer that can be easily treated and does not have many long-term complications. At the same time, people will have to remember that having a goiter does not increase malignancy risk.
Thank you, Doctor. That is also good to know, and I think will put many of our listeners' minds at ease. Having said that, I asked about surgeries, that whether a child can be subjected to surgery if necessary.
Child can be subjected to surgery if it is disfiguring. Otherwise, there's no need of surgery. Even if the thyroid gland is at a place where it is not usually seen, as I told you earlier, we call it ectopic thyroid gland, does not need to come out unless it obstructs breathing or swallowing, or unless it starts bleeding, which is a very rare occurrence. We have never removed ectopic thyroids because of that reason. And even a goiter doesn't need to come out if it is not disfigured. If the child requests, yes, we can go ahead with surgery by an experienced surgeon, but not otherwise. And the size of the goiter also reduces when you start treatment, and also if you continue the appropriate doses of thyroxine without any failure, the size of the gland will not increase in size.
Would you conduct any tests to ascertain the size if necessary? We
can do ultrasound scan and show that the size is the same size or whether it is increasing. Also, if the parents or the person is worried about the lumps and the cancers, you can do ultrasound scan and explain that there is nothing to worry, or we can do a fine needle test and take a small sample and prove that it is not malignancy. So it's a very easy test, not painful, doesn't need anesthesia. They have to go, it's not a big surgery. So it is easily screened for if the parents request, or if the physician feels that it needs to undergo certain investigations to see whether there is a malignancy. Yes, we can do it. But the message here is Of course, thyroid cancers are common. Not very, I wouldn't say very common, but compared to other cancers, it is a common cancer. But having a goiter doesn't increase the cancer risk. That is what they have to remember.
Thank you again, Doctor. Would the diet, now, is there a specific diet that you would prescribe to such a patient to increase levels of thyroxine?
There is no specific diet that increase thyroxine level, but according to the scientific literature, people who are eating fish will have low risk of having this autoimmune late onset hypothyroidism, low thyroxine level, which happens later on in life. That can be prevented by eating adequate amount of fish. And also there are some questions from patients asking whether eating cabbage, broccoli group of vegetables can affect the thyroxine levels. But in our country, the main food item is not in that family, cabbage family. We are eating it as a side dish. It is a small amount of broccoli or cabbage or radish that we take. But there are countries where the main food item is from that group of food, and for those people we are advised to limit. But in our country there is no necessity to talk about the vegetable that we take as a side dish, and very occasionally. It's not a type of food we use for all 3 meals, so we don't have to restrict. But in countries where it is a commonly taken vegetable, then we ask them to reduce the consumption, but otherwise not for Sri Lankan people. That you have to remember. Most of our people come and ask whether it is okay to eat cabbage. Then I tend to ask how often you eat cabbage. It's not very often or not very frequent, so you don't have to worry about it.
In fact, that is something that worries people, and that's sort of discussed. Don't eat cabbage, it's not good for you. Because if somebody has had a thyroid problem, they're very concerned about the intake of cabbage as a vegetable or in any other form. So even in a salad, they wouldn't want to take it. As you quite rightly said, Doctor, we don't eat it that frequently.
And it's not our main meal.
Yes.
It's only a small quantity of, small proportion of meal would contain cabbage. Yes. That cabbage group of vegetables, radish, cabbage, broccoli and cauliflower. Those are the common vegetables that they come and ask whether it is okay to take.
Thank you, Doctor. So once again, Doctor, time is catching up with us. And what would be your take-home message?
My take-home would be to help the screening program and get your child's thyroxine level checked after birth to prevent congenital hypothyroidism and the consequences, because we can treat it early. And also when the children are around 8-9 years of age, if you see enlargement in the neck or thyroid or goiter, get it checked, do a blood test and see whether the treatment is needed. You have to go and see a doctor and see whether such enlargement requires treatment.
Thank you, Doctor. And on that note of advice, we end this interesting discussion on hypothyroidism in children. And thank you to you, Dr. Navodha Atapattu, consultant pediatric endocrinologist at the Lady Ridgeway Hospital in Colombo, for being with us on the program and sharing your expert knowledge on this topic. Thank you, Doctor.
Thank you.
Thank you too to Prabha Veerasurya for technical assistance. I'm Fatima Razikada saying good night and looking forward to your company next Monday same time on Views on Health.